Angela Castellanos. Please be advised that this presentation is only for educational purposes. Today we are going to talk about yeast infection. First of all, I want to present myself. I have been graduated from the High University of Medicine in Mexico in 2018, and I have been working as a general practitioner on the emergencies room. I have to recognize that to be part of the med school requires courage. Courage to do a lot of things and courage to face a lot of things that you are gonna face. But also the passion to get knowledge. Every med student has a scientific heart that guide you to learn, to get the knowledge to help others. I think there are three important concepts that we should keep not just as a med students, also as a doctors. Empathy for others is the first one. When you have empathy for the patient that is in front of you, the patient is gonna recognize you and remember you. The second important concept is tolerance under any circumstance. Please remember that they are patients, they are humans, they need you, and sometimes they need to express their feelings to get better. And don't forget to maintain modesty. My advice for you as a med student is anything you can imagine is real. If you can imagine yourself doing something that you love, that is real, and follow your dreams. So we are going to talk about the yeast infection that is produced, or also called Candida vaginitis or vaginal candidiasis. And this is the second most common cause of vaginal infection that affects up to 3 out of 4 women at some point in their lives. And most of the women are going to experience at least 2 episodes in their lifetime. Remember that vaginal yeast is not considered a sexual transmitted infection because there are many causes that can produce a yeast infection. Some of the most common causes of yeast infection is the disbalance on the normal amount of bacteria on the vagina. And this can be produced by birth control pills that contains hormones, antibiotics, pregnancy, diabetes, some deodorant, tampons, or some perfume douches. Also, wearing tight clothes or synthetic clothes as nylon or lycra can create that the skin gets warm, and the most warm it gets, the yeast grows faster. And also HIV. Some of the signs and symptoms of yeast infection are vaginal itching with or without irritation, a white fluid that is called discharge that looks as a cottage cheese and has nothing or very little of odor, redness, swelling, and soreness on the vaginal opening and around the opening, burning when urinating, and pain during the sex intercourse. Sorry, I think this has been repeated. And the ways to prevent the yeast infection is to try to maintain a healthy balance of bacteria in your vagina. This not just mean that you can follow these steps, but also have a good, healthy meals and regular exercise. Hydrate yourself. Keep your genitals area clean and dry. If you are wearing some pampers or pads, try to often change it. Wear cotton underwear, avoid touching, and only take antibiotics when the healthcare provider asks you to do it and follow the instructions. The diagnosis, most of the cases, can be made just by the health history or the clinical findings. But also we can use vaginal swab. That this consists in to take a small vaginal secretion and send it to laboratory to get results. The treatments for the vaginal symptoms is there are fast choices to use vaginal insert or oral treatment, and we used to recommend clotrimazole or miconazole, and also we as oral treatment we offer fluconazole on tablets. It's important that for external symptoms you recommend to your patient a topical cream as clotrimazole, and this can be used twice a day, or miconazole topical cream to relieve the irritation on the patient. Thank you so much.